Welcome back to your Daily Dose of Dopamine. Again, my name is Robert. You're here with Susan and Indu and Bradley having a fascinating conversation. There were two more key points I wanted to make sure that we hit. And Susan, thank you so much for reminding me of them. From the Prescription for Wellness in Early PD, just what the doctor ordered, this latest paper. And I'm going to read them and then open this up to both Bradley and Indu. Here's number two. Social prescribing and appropriate referrals can be used to mitigate the effects of the reactions that we talked about, the negative potential reactions of a diagnosis, and that engaging psychologists, social workers, and psychiatrists early in disease can be invaluable. So that's point number two. And I'll just throw three in here too, so we have the whole bucket. A proactive approach, including regular counseling on lifestyle choices, should be part of a prescription for wellness that becomes part of the care of the person with Parkinson's from diagnosis throughout the disease course. Okay, so lovely. Who wants to jump on that first?
Indu.
Okay.
Yeah, so I mean, I think we've talked a little bit about these things. So again, I think social support is the sort of buffer that can help many negative things, I think, in many disease states. So I think, again, I think emphasizing that if there's one thing that people take away from this at home, it's that we want people to be not alone and, trying to, we don't ask you as doctors about this. And there's actually, we came up with a less than 1 minute screening questionnaire that was, the UCLA 3 questions that we'll be publishing. But, I think things like I often feel isolated. I sometimes feel alone. These sorts of things are, questions that are part of that questionnaire that are not asked by doctors or medical professionals. And I think this is part of something that we were trying to open people's minds to, that this is part of health and healthcare and that we need to be asking about that. So that's absolutely important. And I value, the multidisciplinary team. We've talked about this. I think, a psychologist and a psychiatrist to use them in our back pocket and hold them there only when somebody's already, had 10 years of diagnosis and already having significant issues, I think is probably too late. Sometimes a lot of these folks feel like they don't have a lot of options sometimes when they get these referrals and they're 15, 20 years into diagnosis and psychotic. They'd much rather be working with some of our patients much earlier on and helping people to understand that, staying mentally and physically active can affect cognition, that it can affect mood, that there's many things that, again, social support can help, and that we need people in our lives to support us to get through, these sorts of times. And so I think, having folks like Brad and Greg as part of this wellness prescription early on, even if it's to educate in a group class, and then to sort of say, come see me if, down the road, we can utilize these, sort of amazing resources in the multidisciplinary team, I think much better than we do.
I love that. And that's it. So it's prescriptive, it's right up front, and it is something that says it's going to be tough down the road. And that's fair. That's the acceptance part of it. The ACT, as you mentioned, Brad, right? This is something you're going to be dealing with, and you can do something about it. So to that end, Brad, what can we do about it?
Yeah, and I think that one of the key points, and Indu talks about this, and it's in the paper, is talking about being proactive, right? It's much easier, I believe, to do the things that help you prevent from getting to a bad place than it is to try to fix it after the fact, right? I mean, take heart disease. Watch what you eat is much easier than developing heart disease and going to a cardiologist and having a stent and everything else done, right? Let's just, and it sounds easy to say, and it's almost a little trite, but I think that there are some things that we can encourage people with Parkinson's to do. And Susan talked about it, and you guys said exercise is one of those things. What about the mind-body approaches? How can we stay healthy mentally? Because let's face it, I think it's clear that the quality of life issue with Parkinson's disease is much more everything non-motor, right? The motor stuff, yeah, it's problematic, but a lot of that stuff we can treat. If you've got a tremor, we can give you Cinemed and it gets better. But what do we do about the demoralization, the psychological inflexibility, the depression, the apathy, which we have no clue what to do with? Right? It's those things that cause the challenges in everyday life. And what can, go ahead.
I was just going to say, Susan, to some of that end, what's the value of a laugh in what Brad just said in terms of kind of cleaning the slate? Where does laughter play for you?
Oof. It's freeing. It's a release. It's therapeutic. It's fun. It's always with other people. So there's a social component to it.
Can
It's
we
just,
prescribe laughter? I mean, is that possible? I mean, you know, Norman Cousins' work, certainly at UCLA, you know, but I have a whole department there based on that, and you know what he did, and that was, you know, one person there. But can we prescribe laughter? There's laughter yoga, that's a thing.
and that goes to my question of, is it ever even reasonable to imagine the wellness community, and specifically the physicians, prescribing things? And my experience is with my movement disorder specialist, if I have something specific that she doesn't deal with, she's fine to say, go see the gastroenterologist, go see the eye doctor. That's not what I do. So I'm not asking her to prescribe yaks, for example, but to prescribe the concept and then maybe have something she can hand me. That's your 15 seconds, Bradley. You
Yeah.
know, if,
Yeah,
100%.
yeah, go ahead, Brad.
Yeah, and it to me, there's a lot. It doesn't necessarily matter what it is that you're doing, as much as it is do something that you enjoy,
There it is.
that you can engage in. It's
That's-
kind of like someone saying, "What's the best exercise for Parkinson's?" Whichever one you'll do, right? I mean, that's the answer. And so, why not just say, "Let's find something that brings you joy,"
There
and
you
that's
go.
going to bring laughter and happiness and gratitude and all those other things that we know have health benefits.
Those things times 1,000 said every day all over. So wonderful. Okay, we have time for one more. We're going to come right back. Thank you so much for wrapping on this paper. We're going to come back and talk briefly about Viktor Frankl and his works and the influence on, I guess, all of us, it sounds like.
Yeah.
yeah.